Today, and this leads to just kind of a general quandary. There's a patient who's older, very sweet, came with his daughter, and he had advanced glaucoma, and the kind of glaucoma where you see really a lot of retinal atrophy on the OCT, so you know it's pretty significant. 0.9 cup to disc ratio, but he also suffered from dementia. And so this is a situation where it's really difficult to ascertain how much of his visual acuity is affected by the reason he saw me, which was a new onset of wet macular degeneration. So he had a very small focal juxtafoveal choroidal vascular membrane that was leaking into the macula. Vision in that eye was about 2100. His fellow eye was 2040. Fairly equivalent glaucomatous optic neuropathy. So one would presume that his vision would be about 2040, but in some of these cases, the vision can be anywhere from 2040 to 2200, and nerves and the retinas look pretty similar. So the question is then, how do you manage a patient that can't quite tell you a good history, has a confounding illness in the glaucoma, and has new onset wet macular degeneration? And it's hard to know, I mean, I try not to be too paternalistic with patients and say, you know what, you have a problem, let's fix that problem. It's really about engaging the patient and their family and talking to them about what fits best for their mother, father, brother, sister, whoever's there with them. So having the family member there was absolutely critical, and that's a little atypical in the time of coronavirus, but at least having someone there that could kind of talk about what their dad's experiencing. And then what I like to be very clear about is to tell the patients and their family, look, I can give recommendations, but I'm really here to serve you. So I analogize that I'm like a waiter that can give them recommendations, but it's their body. I'm not going to force them into having an injection if that's not what fits for them. And so after talking to the patient and his daughter, they decided to go ahead and try for an injection. And I think it's really important to talk to the family as well and say, hey, look, watch to see if your dad feels like his vision's better over the next couple of weeks. And to just engage them in making decisions about their treatment pattern and not just saying, hey, look, you've got this problem and we're just going to treat it because we fix problems. We don't fix problems. We do fix problems, but we take care of people. And so that's just what you want to keep in mind. So just a pearl from today's practice and lesson, and something I wanted to upload and talk about. Engage your patients, engage their family, and getting them involved with making these treatment decisions. Thanks for watching. Oh, and as an aside, one of the things that I really like to do to engage patients who come in and have, don't necessarily have dementia and can actually see the changes on their OCT and whatnot, is I love to treat patients with new onset macular disease, wet macular degeneration, or diabetic macular edema, with their first 3 monthly injections of an anti-VEGF therapy. And then if they totally dry up after those first 3 injections, at month 4, I give them the option to either watch and do as needed, which is fully supported by the CAT PRN study, the Harbor study, all of these studies that did a true PRN with monthly follow-up, and that's the key, monthly follow-up. Or do they want to get an injection and come back 6 or 8 weeks later? The classic treat and extend paradigm. And I like this because at least for after that first series of injections, the patient has some ability to decide and guide their treatment choice and their treatment recommendation. And it gives me insight into where that patient's pressure point is. Does the patient really not want to get a shot in their eye, so they prefer to come back more often and wait in the office and get seen and whatnot? Or do they really have travel burdens and travel restrictions, or fear that they don't want to get worse, so they want to go ahead and get an injection and come back less often? And so in the very first round of injections, you can figure that out pretty readily. And that can kind of guide and dictate your course for the rest of their care. Once again, thanks for watching. Like, comment, and subscribe.